I'm Dr. Ryan Stanton, and the doc is in. Well, medications are common. Leftover medications are about just as common. The most common leftover medications include antibiotics and pain medications, where people get the prescription and don't take the entire allotment of pills. Now, the issue is these being left around can cause significant risk of exposure, whether purposeful or accidental. The FDA is stressing proper disposition of these medications. Some people consider flushing these medications down the toilet, but this is not recommended secondary to the exposure of chemicals and medications into the water supply and wastewater treatment plants. The best way to dispose of these medications is through drug take-back programs or mailing them back. Those tend to take place around our communities and with controlled substances, typically at law enforcement locations. Now, there is a list from the FDA of certain chemicals that should be flushed down the toilet. These tend to be controlled substance and opioid-containing medications and a couple of others. The reason they suggest these being flushed down the toilet if there's not an immediately available take-back program is because the one-dose potential for death or complications. So anything that could cause a death with one dose, especially in children, or purposeful exposure with high risk of diversion, they do recommend, if there is no other way to do it, to flush those down the toilet. That list is available on the FDA website, and also check it out to find the best take-back program for your other medications. You can join our conversation on our Doc is In Facebook page and at Everyday Med on X. I'm Dr. Ryan Stanton, and the doc is out.